Hi, everybody. I'm Scott, and thanks for joining us again for another episode of the In Medicine and On Medicine podcast. As always, this is Susan. Hi, Susan.
Hi.
Susan is an Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. Her contact information runs across the screen every so often, so you may get in touch with her with questions, make an appointment, do something other than just gamble when you're here in Vegas, take care of your health, might aid you in your gambling, who knows. So anyways, today we've got an interesting topic to talk about. Once a week or so, we have a little strategy call where we say, what should we talk about on the next show or two? And when I got Susan on the line for the recent one, she was like, I've had nothing but one traumatic injury patient after another this week. Mm-hmm. And so I said, there you go. We don't even need to have the call. There's our topic. Where do we begin? What do we even mean by traumatic injury? And then let's launch into how your type of medicine helps with it.
Okay. So what is traumatic injury? Well, it kind of is what it sounds like. It means something kind of violent happened and has injured the body. So there's something in Chinese medicine called Jingshang, okay. And that means it has a long history. It goes way back, and it's basically treating injuries to the ligaments, tendons, muscles, bone, subcutaneous tissues that's caused by some kind of violent force. Okay. Twisting or some outside force or something like that. So
we all know about traumatic injuries in sports.
Right. It's the same as in Western medicine. Is sports injuries, falls, car accidents. But we also look is it acute or chronic, right? So because that has a strong implication for treatment. So
what are we talking about?
Right. So it's like, did it just happen?
Okay.
Or is this like an ongoing thing? Like I just talked to a patient today who's had this chronic foot pain for a year. And
God, that's got to be uncomfortable.
Oh, it's terrible. And just got an x-ray, and the doctor said, well, I was expecting to find arthritis, but there isn't arthritis. This is a tendon problem.
Okay.
So basically she's been overusing it for a year, and so she has to change her behavior, and then she's going to come in tomorrow, and I'm going to show her how to tape it.
So the trauma is happening to what? To the foot, to the ligament?
Yeah, to the little tendon, this one little tendon. So that's more of a chronic kind of a thing, like overuse or some...
What about computer injuries?
Right, like some professions just tend to give people chronic injuries, like people that work at a keyboard, people that have a mouse all the time, or, people that work in more physically demanding kinds of roles. One thing that years ago, my goodness, so many years ago, one guy that I worked for a long time ago once said, if you want to see people with really good body mechanics, people that like move really well and might like do heavy lifting, but do it really appropriately and really good. He said, look at old construction workers because there aren't any. So when you see one, it's definitely somebody who has taken care of his body, right? And maybe not even known.
Right.
At the time, he showed me this big study that somebody had done on miners, because again, there's no old miners either. And so when they found these old guys who were still mining, which is dramatically difficult, what they found was these guys were like perfect. They had perfect body mechanics, and they actually studied their movements and taught how they moved to younger miners.
Okay.
Right. So, hey. So anyway, so that's what we look at. Is it acute or chronic? And what does that mean? And then also there's like stages of traumatic injury. So the initial injury is like when it first happens, so it really hurts. There's swelling, there's pain, there could be bleeding, like it's bad. Okay. And so in our medicine, that means that the Chee and the blood have been injured. Okay. So maybe I should back up and talk a little bit about the Chee and the blood.
We should never assume that people have seen all the other episodes.
Right. So there's this stuff called Chee. We talk about it every week. It doesn't have a physical form, but we know of its existence because of its effects. And in general, dead things don't have Chee and living things do have Chee. But
You're
shout
simplifying.
out to the feng shui people because, of course, there's Chee everywhere. But for our practical purposes, there's basically it's this energy that flows through the body in a really complicated way. And everything in Chinese medicine has an energetic component, right? Because and acupuncture is an energetic medicine. So we move the energy and the physical part of our body follows it, right?
Okay.
So everything in Chinese medicine has an energetic component. And so if I say the blood, I mean the red stuff, but also there's an energetic part to the blood. And the blood and the Chee have a very intimate kind of relationship where the Chee is said to command the blood. And the blood is said to be the mother of the Chee. And I'll get into that a little bit later. So basically, you can't really injure one without injuring the other one. And so...
Oh, that's interesting. Okay.
Yeah, kind of. The other thing that we look at in Chinese medicine, I think I'm probably getting ahead of myself, but... is that because the body is an integrated whole, like I think that's one of the great things about Chinese medicine where it differs from Western medicine is, and I'm not here to criticize Western medicine for God's sakes, but because we look at the body as an integrated whole, we also look for and find often that a traumatic injury has affected the internal organs as well.
Okay.
I'm trying to think of an example, like
sports stuff makes perfect. Because like a hockey player getting slammed against the boards. There's more than just like the hip bruise there. Who knows?
Well,
what's going on
yeah,
inside.
and we actually, but I was actually mentioning it more like people have a traumatic injury and then they get constipated.
Oh my, okay. So that
Whereas in Western medicine, they wouldn't think those two things had anything to do with each
you got
other.
your channel thing, and then makes sense.
Right,
then, right?
and because there's a Chee and blood problem.
Right.
That can affect the internal organs and cause dryness or stagnation, either of which can cause constipation.
All right, hold on a second. Let me back you up a little bit. First of all, do you see one versus the other more often, acute versus chronic?
Definitely more chronic. And that's because, that's what the ER is for. I mean, if you're in a car accident, don't tell the paramedics, oh, take me to my acupuncturist. Don't do that. Like, go to the ER because they're professionals,
Right.
and they know what they're doing. But they look at the body more the way like engineers do, and so they tend to if your leg is broken, they're looking at your leg. Like I slipped and fell at Costco years ago and broke my arm, and nobody cared about the rest of me. They were just looking at my arm.
Right.
Which makes sense, which is not wrong by any means,
Well, that's the way Western medicine works.
Right.
Does it amaze you sometimes as a practitioner to see what and how long and how intense people will put up with chronic things until they come to you?
It's
Or
unbelievable.
until they go to anybody, I guess.
It's unbelievable.
And
And the thing
it's
is-
going to go, the hope that it'll go away.
Or if I ignore it, it'll go away. And I'm guilty of that myself. It's like, I'm not going to pay attention to it. But also, like, people won't even tell me,
Right.
or
We're
like
coming to see you for something
else. And then, and then I'll say, is anything else going on? Well, no. Any aches or pains? Well, no,
Or
not
you
really.
get the doorknob thing on the way out.
Right. Like they have their hand on the doorknob, they're leaving, and then they go, gosh, this knee has been hurting me for 15 years. And I'm like, what? Your knee has been hurting you for 15 years? Like, could you have mentioned that earlier? But that's pretty funny. So anyway, is it acute? Is it chronic? And then we're looking at the stages. So the initial stage is, the initial injury. So that's when the swelling is worse. There might be bleeding. There could be loss of range of motion, a lot of pain. That's in the beginning, right?
So do your range of treatments differ if they come to you at the beginning versus
Yes.
a more chronic stage, or even on
Yes.
an acute thing if they don't come to you at the beginning and wait a couple of days or something?
I mean, I have over the years had people come with an acute problem. I mean, I'll never forget. I had this man walk in my office and he was like, like walking like this, and I was
Right.
like, okay, let's see what we can do for you here, which was pretty funny. He was I don't remember his name, but he was he owned a bar, and he had lifted up a keg of beer and hurt his back. And he said, I've done this before, and I've gone to acupuncture before, and I know that this is going to work. And I was like, okay. And he was right. I mean, it did. But so then there's the second stage of a traumatic injury where, okay, the swelling has gone down, and now we can see more of the bruising really come out, right? The pain is lessened. In most traumatic injuries in this second phase, many of them will resolve on their own, right? They'll
So
get
in most
better.
traumatic injuries, it's a spike, and then it comes.
Yeah.
The body settles back down.
But
Okay.
let's say, after 2 weeks, then that's the third stage. And that if things, if 2 weeks after the initial injury, if there's still, a lot of swelling and a lot of pain, then we're talking, now we're moving into a different phase, because it should be resolved. And if it hasn't resolved in like 3 to 6 weeks, then we're talking about it becoming a chronic problem rather than an acute problem.
Does it matter if it's being treated or not?
Like in Western medicine?
From anything. So if I have this problem and I treat it and it's not getting better and becomes chronic, versus if I don't treat it and it becomes chronic because I wasn't treated, are those different paths that the injury is walking on,
that's
or
a good
no?
question. Well, I am often amazed at how dedicated people are to a certain course of treatment, regardless of whether it's working.
Okay.
So often I'll say something to someone like, oh, okay, well, you've been doing these series of exercises for 6 months. Has it helped? And they'll say, no. And it's like, that's very dedicated, but it's not working.
I'm going to the physical therapist over and over and over.
Right. Which, physical therapy is terrific. And, but again, they're looking like this, right?
Well, and it's supposed to be a short-term treatment that resolves something. Otherwise, it's not.
And they know what they're doing. So if
Right.
it's not getting better, then something is missing. And, I've often had that happen where, I had a patient who had back pain. Oh, this back pain. Oh, my goodness. And she was getting massage therapy at least once a week. And I saw her right after she got off the table from the massage therapist, and her pain was worse. And I said, well, that can't be. That can't be. Something's missing. Something is missing. And because I was able to order an MRI for her, which I can do in Nevada, even though I can't do it in other states, and she got an MRI, and sure enough, she actually needed back surgery, which was kind of amazing, because I have a bit of a prejudice about back surgery, because
it scares the crap out of me.
Well, because I only see the failures. Like when people have a terrific result with back surgery, I don't see them. I only see the ones that it's gone horribly wrong, or it's just been a terrible experience. So I tend to have a wary and worried attitude about back surgery. But in this patient's case, she had back surgery. It went perfectly, and she had a real success with it. And, she could have kept going to the massage therapist forever, and it wouldn't have worked. So that was a really good learning experience for me too, to see, it does work. Just because.
Let me back you up a little bit more again before we go on. So what are the general causes of traumatic injuries? What do you see the most? Is it different between young and old, athletic and not, healthy and not?
Yeah. So, as far as what causes traumatic injury, again, sports, exercising, falls, car accidents.
Oh, that's got to be a car accident's got to be.
Yeah, I actually am just seeing somebody from a car accident, and I don't take insurance anymore, but this person is somebody that I knew, and I just really felt pretty strongly that acupuncture was kind of the missing piece. She had done physical therapy and massage therapy, and there was like little piece that wasn't working, and she's responded really
How
super
often
well.
is that? That's got to be a regularly
Yeah.
occurring theme for you, that
Yeah.
acupuncture is the missing piece.
Yeah, it's
Or if
like a
you'd have
little
co-
missing piece.
If you'd have come to me earlier, the puzzle might have been put together sooner, and you might have
Right.
even avoided some of the other things you've done. Yes.
Right. So this patient, the car accident patient, came to me, and I think it was like 8 or 9 months after the injury,
Oh, okay.
and she still had like all these problems, and she had been doing stuff, but that's why I thought, they're fixing the physical part of the body, but there's an energetic problem. And sure enough, the first acupuncture treatment she had this like amazing response. It was like wonderful. It was like a dam breaking. It was great.
Is there a time frame to recovery for these injuries, or it's different for every injury? But you should be seeing progress. Is that
Well,
the
yeah, I mean, the
important thing?
acute phase is the first 2 or 3 days.
Okay.
Then the second phase is like the next 10 days.
Okay.
And then after 2 weeks, you should be in the third phase. You should be, on your way to
You should be
recovery.
improving, right?
And between 3 and 6 weeks, I mean, it should resolve. So if it doesn't resolve, then something's not right.
And even with like some of those tendon injuries and overuse injuries, because sometimes they may want you, taking 6 weeks or 3 months off from the overuse.
Right. So I should probably mention that, like, if you think about, or if the audience thinks about, like, like, most of us don't see the insides of human beings, but we look like the insides of other animals. And so if you look at, like a piece of beef or something, the red part is the muscle.
Okay.
Well, why is it red? Because it's filled with blood, right? And then the tendons, so in a piece of beef, that would be the shiny, impossible to chew part. Okay, so that's like a tendon, and it's kind of white, right? So it doesn't have very much blood in it at all. And ligaments are that way too. They have even less blood. And then, bones basically don't have any. So
which all means what?
that's like how things heal. So muscles heal faster because they
'Cause
have
they have
more
blood.
blood, whereas tendons and ligaments heal much more slowly because they don't have any blood. So like
Okay.
my patient that just discovered that she had a tendinitis in her foot, she is not going to want to stop walking. And too bad. You're going to have to, because it's already proven itself to be a pretty chronic condition. So she's going to have to really stabilize that joint and let it rest, or it's just never going to go away.
So can these chronic conditions, if they're not addressed, hit like a new level of acuity, or get worse, or it just stays bad?
Well, it can just lead to other injuries, right? Because it's a weak spot. It's a weak link that has to be compensated for. And so that can cause all kinds of complications where, sometimes people come in and it's like peeling an onion. It's like, what was at the start of this? Or what started all this? I can't even figure it out. It's so complicated. And then you just start peeling the onion until you finally figure out what the original injury was.
So tell us what the great transition, tell us what that peeling the onion process for you in treating these things looks like, and how you get to, in your differential diagnosis, figuring out what it is, that it's not something more than what they're voicing to you, or saying what the problem is, or what the connected channels are and whatnot. Like what's the whole project, and is this any of this different than how you normally treat does for cold or flu or whatever? I know that was a lot in one.
That was a
big
lot.
gulp of air
That was,
there, but
that was a lot in one big gulp of air. But so, well, as with anything, first of all, there's usually a story involved with traumatic injury, right? So, I was dancing and I tripped over my own feet and I fell on the floor, or I was in a car accident, or I fell off my roof, or I, tripped over a stool in my kitchen and slammed my head into a garbage can.
Are body height falls, I mean, just us falling, those are they can be amongst the most dangerous things that we take for granted, huh?
Oh, absolutely. I mean,
regardless of age.
I remember a friend of mine who years ago had a horrible traumatic injury where he was pushed off the top of a cement plant and landed on his hands. And this was back before there were paramedics, right? And so he broke his arms in like 30 places, and woke up in the ER with one of the ER docs sitting on his chest trying to straighten out his arms. And he had, tons of surgeries, and parts of the bones were amputated and plates were put in and all these things. And I'll never forget, he told me he was sent to a rehab center for 9 months to figure out how to move his hands again. And he said he fell like 30 feet. And he said there were people in the facility that were quadriplegics who had fallen less than 6 feet. So it doesn't really matter how far you fall. It just matters how you land.
How you land, right.
And I mean, people, it's amazing how people can be. I mean, I've had people break their legs and all they did was step off a curb. And it was just sort of how it happened. I mean, it wasn't that they were, weak or infirm or old or anything like that.
No,
It was
it's just the way, the movement.
It's just the way that it happened. So, but before that, you were asking me like how we
treat, how we figure
how we
it
look
out.
at it, right? So how we look at it. So we listen to the story, and then we figure out, okay, is this an acute problem or a chronic problem, and what's injured here? Is it the chi? So, like for example, let's say people have swelling, and then they have pain. To me, that says, okay, that's a chi stagnation problem. The chi has stopped moving, and the stasis has built up, and now they feel the pain, right?
And so what does swelling mean for us laymen?
Well, in Western medicine, it's the body sending a flood of worker bees to the injury to clean it out and fix it and repair the damage. Okay, white blood cells, and a million different kinds of white blood cells and all kinds of stuff like that. Swelling in and of itself, though, can cause what we call secondary injury. If the swelling happens so fast, it can actually damage more tissue. So that's why, like in Western medicine, they don't want you to put heat on a new injury because it'll bring more stuff to the area, and there might be already too much. So that's why they would always say, ice. Okay, which is not a bad thing. Okay, but then you want to control the swelling. So then often they'll say, okay, now you can alternate ice and heat. Okay, but they reserve heat for when it's been weeks away, and so there's no more threat to secondary injury.
Okay, so then what do you do on the Eastern medicine side? How do you look at it, and what's your...
Well, we don't really do ice in Chinese medicine, although I would agree with Western medicine that in the first 24 hours, ice is probably a good idea.
Okay.
So, is it the chi? Is it the blood? Is it the body fluids? All of those things are sort of related to each other. So, for example, if there's a lot of swelling in one area, we usually find that there's dryness in another area.
Okay.
Right? And then we look at the internal organs. So, now we talked about the internal organs before, but I'll just rehash a little bit. So, the organs in Chinese medicine are different than the organs in Western medicine in that they're not just the organ, they're more like a sphere of influence or like an umbrella. So like if I say the liver, I mean the liver, but I also mean like the energetic part of the liver because there's liver chi, okay? And then there's a channel called the liver channel, and then there's like a sphere of influence of the liver, of what the liver rules, okay? So the liver rules the tendons and ligaments.
Okay.
So injury to the tendons and ligaments can often injure the liver. Injury to the liver can also often injure the tendons and ligaments. The spleen and stomach, and again, it's like an umbrella. The spleen and the stomach, the spleen in particular, has a wide sphere of influence, and it has an energetic part, and it has a channel, and it rules, in part, the muscles.
When I was having my gallbladder problem, and they went down the channel in my leg, affecting my walking.
Right, and it didn't go down the front of your leg.
No,
it didn't go down the back of your leg.
Right,
it went
side.
down the lateral side of your leg because that's where the gallbladder channel is. And so, so then the lungs and the heart together really are involved in the chi. Okay, so again, if the chi is injured, we can see issues going on with the lungs and the heart. And then the kidneys rule the bones. So often we see kidney damage, or not damage, kidney problems associated with bony injuries.
You mentioned a moment ago about if you have swelling in one area, you'll often find dryness in
Yeah.
another. So does that mean that, my swollen ankle is taking from another area and
Well,
redirecting
I kind
resources?
of look at it that way
Okay,
just
okay.
because that's what I
That's what
see
it
every
sounds like,
day.
and that's what creates the dryness,
Right.
and that's what creates the swelling.
Right, because everything in Chinese medicine is about harmonious balance. So if you've got too much fluid in one place, you probably don't have enough in another.
Right. Okay.
And so that also happens with traumatic injury, because one thing that happens with traumatic injury is something we call stasis, right?
Okay.
Because when the chi and blood are flowing through the channels and collaterals the way it's supposed to, everything's great, right? Like water in a river. It's flowing, everything's fine. You don't have pain, you don't have swelling, you don't have anything. You're fine. It's when things aren't moving, when stagnation happens, that problems arise somewhere. And traumatic injury, a hit, a fall, a twist, something like that, stagnates the chi and the blood. So you've got stagnation. So that means,
And it's an abrupt stagnation
yeah,
too, right?
and that means that the other chi and blood in the body can't get to where it needs to go. So then the problem ends up sort of mushrooming and getting even
cascade, yep.
bigger. So we want to create movement. We don't want things to be stuck. And so we use different techniques like acupuncture to move things. There's something called a plum blossom needle, which is a little hammer that has like 7 little needles sticking out of it.
Oh my.
Yeah, we can put a picture up of one anyway.
What's it called?
Plum blossom.
Plum
Well, there's one called a plum blossom and one called a 7-star. They're exactly the same thing,
Okay.
except one has 5 needles and one has 7 needles.
Okay.
Um,
And what's the advantage of that, of having them attached so that you get?
yeah, you do this little hammering technique.
Oh, okay.
And it's really, really good for moving chi and blood in the
Okay.
in the channel. So a lot of times we'll see that the chi and blood in a channel, like maybe the person has a knee injury and the channels above and below the knee are congested, and so we can plum blossom them to get the chi and the blood in the channels
Okay.
to start moving again.
So you want that excess of liquid in the swelling to move on.
Yes.
Okay.
Yes, we do. And like any other type of differential diagnosis that we do, we also do look at the pulse and the tongue. The tongue and the pulse tell us the same things diagnostically, but the pulse changes rapidly and the tongue changes more slowly over time. So in an acute injury, we wouldn't see a change in the tongue.
Okay.
After 4, 5, 6 days, we might start tending to
Okay.
see it. Like I just had a patient who had, how long ago was it? 7 days ago, I think. She had a relatively minor, but still very uncomfortable gallbladder problem.
Okay.
And
Radishes.
yeah, I know. I told her about the radishes. And her tongue was dramatically different because I see her tongue a lot and it always looks a certain way or within, generally the same way. And then that time I just went, whoa. And she's, which they teach you day one in acupuncture school is never go, whoa, when you look at someone's tongue. Like that's
Right.
like the first thing they say is, and the second thing is don't say oops,
Right.
But yeah, and I said, oh my goodness, I got to show you your tongue. And so I had her look in a mirror and she went, wow, that looks really different. And I'm like, exactly. And then I showed her, you've got these, she called them, quote, parentheses on her tongue, but it's the gallbladder area. And
Okay.
she had what we call damp heat in the gallbladder. And she had these 2 stripes down her tongue, which were never there before. And, so we take the pulses and we look at the tongue. The pulse will change immediately when people have had an injury. The pulse will reflect that. And so we do the tongue, we do the pulse, we get the story, we can palpate the channels, we can, touch things. And we also do, similar types of range of motion tests. And, we check the involved limb against the non-involved limb,
Mhm.
and we measure, how much flexion and extension they have or whatever, we have to do. So that's a similar thing that we do with Western medicine. But one thing we do too, we do the tongue, we do the pulse, and we also tend to look at the complexion. We tend to look at like, what does this person look like? Like, do they look kind of ashen or do they look unhealthy? Because that to us would be like a bad sign. It's kind of like if the injury looks terrible, but the person's pulse is relatively normal, then I'm like, okay,
It's more of a localized.
they're probably going to be fine.
Right.
Whereas if the injury doesn't seem that bad, but their pulse is terrible, then I think, ooh, maybe this is going to have a worse prognosis than I might think. So that's some of the Chinese diagnostic stuff that we do.
What
So,
about traumatic injuries caused by other means, like side effects to medication affecting organs, or chemo or radiation doing organ damage? Is that considered chronic or traumatic
well,
injuries in any way, or do you look at that as something totally different?
let me think about that. So,
Or
wait,
an
ask
organ
me that
affected
again.
by illness, like people had all these COVID things that affected organs, and
Well, COVID's a whole
whole other
different
ballgame.
thing. We
Okay.
should probably do an episode about
Okay.
COVID because COVID is just still
Well,
with us.
put it on the list.
Yeah. So, could you ask me that question again? I kind of got
Well,
lost.
I'm just trying. Are other types of
Oh, you were asking
bodily
me.
injuries?
Yes.
Is that considered this,
Yes.
or is that something different?
Y-
Because organs will get injured in other ways other than bangs and
Yes,
whatnot.
yes, and I should mention that the traumatic injury that's due to like an external force or something has a funny name in Chinese medicine.
Okay.
It's called hit medicine, which that makes sense.
Makes sense.
Makes sense. So yeah, so there's the acute traumatic injury. Then there's like secondary injury. So like for example, let's say you're in a car injury and you get whiplash. And everybody's kind of focused on your neck, but the seatbelt really gave you hip pain. So you have like kind of a secondary injury that's not the main injury, but is still significant. So there's that. And then there's the injury to the internal organs, and also the internal organs reflected in the injury. So, for example, let's say you've got somebody that's got like what we would call a liver blood deficiency. Okay, so that's their underlying constitution is they don't have enough blood. Okay, well, if you don't have enough blood, then healing is going to be difficult. So if somebody has a pre-existing liver blood deficiency and then they fall or something, then it's harder for them to recover in a timely manner because of their underlying constitution.
And would that go with any kind of
Yeah.
pre-existing?
Like let's say somebody has asthma, and so maybe their lungs, they have lung Qi deficiency. Well, if you have lung Qi deficiency and then you have some kind of injury, it might take you longer to recover because you don't have enough Qi to really create the healing process or to facilitate the healing process. So that's why we always take the tongue and the pulse, and we always treat the underlying constitution at the same time because everybody's got something.
Right. So how do we fix all this?
So
how do we move us from having either a chronic or acute issue to back to the stasis that you want us to have?
Well, a couple things. So first, we have to come up with a differential diagnosis.
Okay.
So, like, let me think. Foot pain due to Qi and blood stagnation.
Okay.
That means it hurts
Okay.
because when the Qi and blood stop moving, things hurt. With underlying kidney Qi and liver blood deficiency. So that's the diagnosis. I just made that up. Okay. So,
but you're always looking for the secondary underlying thing.
Personally, I always do that.
Oh, okay.
I always do that.
Or do you not have to look for it because it's just going to tell you as you do your
well,
tongue?
Personally, that's what I think.
Right,
but I mean,
right.
there are practitioners out there that don't do the tongue and the pulse. I don't know why, but they don't. Or people who just want to treat like the local injury, but I don't look at it that way.
So again, going back to that, you're looking well beyond the injury that we're coming to see.
Yes, absolutely. So then if I've got some tricks up my sleeve. So one of my big tricks is acupuncture. So I would create a point prescription, it's called, utilizing local points. So, I'm working on the elbow, local points on the elbow, but also distal points on other parts of the body that will treat the elbow and treat the underlying constitution, right? So I treat both of those things at the same time. And then there's a bunch of other cool stuff you can do. Like, for example, Like polarity. Polarity is pretty.
What's what? Okay,
Polarity's
here's a new
pretty
one.
wild. Yeah,
Here's this.
polarity's pretty
By the way,
wild.
we're on episode 50. We're at this for just
Yeah,
about a year.
almost
and
a
I
year.
haven't heard the word polarity yet, so tell us what that means.
Well, polarity is kind of a big concept, but I guess in this context, polarity is that you can use one part of the body to treat another part of the body.
Okay.
So like back in the old days, like I don't see a lot of people in casts anymore. Like they don't really do that anymore. But it was great. Polarity was great when people were in casts because you couldn't treat the limb that was in the cast. You would just treat the other limb,
Oh.
right? And so often that can really work. So like let's say the leg is really injured, and the patient like really does not want to have needles in their leg. Then fine, we'll put needles in the other leg, and we'll do some what's called tuina, which is a type of Chinese body work. We'll do some body work to the leg. We'll start out gently, we'll go a little deeper, and then we'll end gently. And so that's like polarity. You can treat the left side. You can treat the left side to work on the right side. You treat the right side to work on the left side.
Will you use something like that sometimes if the injury is too tender to take the needle?
Oh
in?
yeah. Yeah.
Like your patient with the tendon in the foot. They may
Oh
not be
yeah,
able to
that
take
would
a
hurt.
needle in the foot. That might
Yeah,
hurt down there.
That's gonna hurt. Yeah, that's gonna hurt. Although I have a technique that makes it
But
hurt
it's
less.
relatively successful if you try and move the chi on the other limb.
Oh yeah,
and
polarity's crazy. I
Okay,
mean,
yeah,
polarity's
it's
like,
just
how can
an
this even
amazing
be?
concept.
It's like you put hello, you're putting needles in my right knee, and the problem's in my left knee. It's
Right.
like I know. Wait till you see what happens.
Yeah, no, and polarity, a new term.
Polarity is pretty cool. You can also treat the upper body to treat the lower body to treat the upper body. And then there's things called microsystems. So like, for example, ear acupuncture. We did an episode on that.
Yep.
There's over 400 points in each ear. So, if you can't treat the body, you can treat the whole body just by using ear needles. So that's a microsystem, and there's a few of them. There's one I'm not as familiar with right here on the hand. There's a few. Hand and feet. Yeah, hands and feet.
Is cupping involved in
Yeah,
swelling
yeah.
treatment at all? It's not, but
Well,
the
not
blood's
for
not on the
swelling.
surface so much. so-
Well, cupping is really good for a few things. One is if there's like numbness and tingling, which is
Okay.
more like blood deficiency, where there's maybe stagnation over here and then there's deficiency over there because everything's stuck. So cupping is really good for that. Cupping is really good to get things moving. Cupping is really good when your muscles are tight. So like I just saw a patient today who one of her main complaints is neck pain.
okay.
And so I learned this technique, I don't know, like maybe 30 years ago. Like I don't even remember who taught it to me or where I learned it. I don't know. But I have this little thing that I do where I just palpate the cervical vertebrae, and then I just kind of do this little gentle kind of rotation if the vertebrae is out of alignment, and just sort of schmooze it back to where it's supposed to be. And I'm talking like millimeters, like
Okay.
just millimeters. It's non-invasive. It's nothing like any kind of chiropractic treatment at all.
Okay.
It's not anywhere. I'm not doing an adjustment. I'm not doing anything like that. But anyway, I did that on her the first time I saw her, and she had like this really good result, No neck problems for over a week, and it had been bothering her it had been kind of a chronic problem that she'd suffered for years and years, and it was like remarkably successful. So I just saw her today, and she hasn't had the neck pain in a few weeks. And then yesterday, she started feeling like her muscle right here, this trapezius, right,
Okay.
was getting tight, and then her neck started feeling like it's.
So you feel it coming back on.
So she came in today, and sure enough, I palpated her upper trap, and it was like a rock, right? It was so tight on one side, and sure enough, one of her vertebrae was just like a little tiny bit
And
that
that's
I
all it
could feel.
takes.
And that's all it takes. That's all it takes. So what I could do is I could like just derotate that vertebrae just a little bit. Do acupuncture to open up the channel that runs up through the spine, because when we move the energy, the physical part of the body follows it. So you activate the energy, and then the little vertebrae that's 2 millimeters out of alignment, and it just sort of moves back to where it's supposed to be. And then I cupped her, and that was great. I mean, she just got up and was like, "Oh my God, it's gone."
So depending on the severity of the acute or chronic injury, what's the time to heal using your type of medicine with these things? Is that there you can't give that answer? Is that is it also is it
Well, it
like with
shouldn't
anything
take
else? The
forever.
sooner I come to you, the
Yes,
better.
that is always the case.
And the chronic ones, it's going to take longer.
Right, chronic stuff takes longer, but and chronic stuff usually the patient has to be a little bit more involved, because there's probably a pattern of behavior that needs to also be addressed, like the patient that's not going to be able to walk like she does if she ever wants this foot pain to go away. So, and that's going to be a tough one.
And what happens if she doesn't? Does it just get worse? Does it affect other parts of the
Well, it just
leg and the
won't.
body?
Yeah,
And,
it won't ever heal.
well, does it go?
and-
Will it start going up her ankle? And I mean, like,
no, but I mean, she could develop like arthritis or bony problems in that
and then
foot.
what about the overcompensating in the other?
Right, and then she
limb
can
that's
develop
not
pain in the
injured?
other
Right,
foot.
right.
I mean, it can just really get bad. But what's difficult is, when people have to stop a behavior.
That's hard.
Oh, that's tough. If you can replace the behavior with a new behavior, that's way better. It's like, that's like, stopping smoking. I mean, it's really hard to
So
stop smoking,
what do
but
you
you can
replace
replace
walking
smoking.
with?
Exactly. She's just going to have to figure out some way to replace the walking with something else.
Okay.
And what is she going to
Something
do?
that's not traumatic on that tendon.
Oh, I just thought of something she could do.
What's that?
Well, she goes on these long walks with her dogs, and
Okay.
she was like, the doctor said I should ride a bike, but I can't ride a bike and walk the dogs at the same time. You know what she could do? She could take the dogs to a park and do some serious ball throwing with them.
Yeah.
She's got a pretty big yard, but I
Yep.
mean like a really big yard.
Yep, yep.
Maybe get one of those wandy things
Yep.
so you can throw the ball really far. That might be good because then
Then
wouldn't
she's
have
taking
to,
it
yeah.
easy, and the
I
dogs
think
get
I'm
what
going to
they need.
suggest
There you
that
go.
to her. I think I'm going to suggest
There
that
you
to
go.
her. That's a good one. Yeah, I like that idea. So let's see, where were we?
Well, so I come to see you with one of these injuries.
Oh, how long is it going to take?
Yeah, how long? And
Right.
are people going to notice a difference, like on the first treatment, or
Well, God, I hope so.
okay,
I mean, so like what I tell people, if I'm confused, if I'm a little confused, I'll tell people, okay, look, I'm starting your treatment where I think the logical starting point is. I could be wrong. So treatment is diagnostic. So the next time I see you, I'm going to say, okay, were you better, worse, or the same? So that's what I say when I'm really
I got a
unclear.
question there though. How could you be wrong when, again, we've done this for a year now, telling us that the tongue and the pulse are always right and don't lie and whatnot? So
Because things are awfully layered. So it's kind of like, that's a good question though. So like things are like what takes precedent, right? So let's say the person has, there's 8 components to their problem. Okay, I think this one is the most important one, and some of these others are going to resolve on their own if I'm correct. Maybe I'm not correct. Maybe it's this one that I should focus on, and these will resolve on their own, right? So it's like playing 3-dimensional chess. I mean, it can really be like, whoa. But almost always, I mean, literally 98% of the time, there is some positive change that helps me go, okay, I was either right or I was partially right, and now I have to add this other thing in. When someone has absolutely no improvement whatsoever, they don't get better, they don't get worse even. Nothing has changed. That's like the woman with the back pain. That's when I start thinking there's a surgical problem.
okay.
And sure enough,
So you want
that's
to
what
see
happens.
change, even if it's
Yes.
that you made
Even
it
if it's
worse.
bad, yeah. Even if it's worse,
Because it
which
means
hardly
what, that
ever
you can
happens.
move it,
That
right?
that it can change.
Okay,
Yeah,
right.
I mean, if we can change it, then we can fix it.
Okay.
But if we can't change it, then it's probably a surgical problem.
Okay. What about do Chinese herbs come into play here, and especially
Oh, yeah.
like using you taught us about envoys and whatnot. So like give us the whole download on herbs and traumatic injury.
Oh my goodness! Well, there's a million traditional formulas for herbal medicine. There's also a whole bunch of topical applications of herbs. I mean, God, I have so many recipes for plasters and things that you apply externally. But then there are also a bunch of herbs that you take internally, classic formulas that, I mean, and there's one like one that pops out of my head is there's a patent or a pill called Yunnan Bayao, which
Okay.
has been used, I don't know, forever. I don't know, for traumatic injury. It's really interesting. I believe it's 12 pills. There's 12 pills, and then there's a little red pill. So the little red pill, you take that one first, and
Okay.
that's for traumatic injury, and then you take the other ones like 3 times a day for the next 3 days.
Okay.
And it's great.
Wow.
Yeah, it works really well. Nowadays, you can also buy plasters that are like, like if people are familiar with like Salonpas or something
Mhm.
like that. There's a bunch of Chinese herbal patches that are really good to apply topically. But some people have really sensitive skin, and that doesn't really work for them, or they might have an allergy or something. So you got to be careful with external applications of things. And then, there's all these formulas. Like there's a formula that the translation of the formula is formula for a painful body, which is basically for pain anywhere, everywhere. Um, Formula for pain above the diaphragm. Formula for pain below the diaphragm. There's just all kinds of formulas that go to the joints, and that relieve different things, different symptoms there. Also, I should say that just to back up a little bit, that if an injury is not treated correctly and it becomes chronic, the other thing, like you said about my patient with the vein in her foot, with the tendon problem, the other thing that does when it doesn't resolve, where it's not given time to heal, is it's a really vulnerable point for an invasion from an external
Right.
pernicious influence, right? So we talked about those
Yep.
EPIs, right? External pernicious influence. It's something that comes in from outside the body and invades. And in Chinese medicine, that's heat, cold, wind, damp, dry, and summer heat.
No, it's like, as I've said before, I always feel it in my gallbladder before I get sick.
Yeah,
Like literally,
because
because that's been my weak
it's the
area.
weak link,
Right.
right? So, like for example, one external pernicious influence that can invade the body and really make you feel terrible is something called wind, cold, and damp.
Okay.
Okay, so windy pain moves around. Damp pain feels heavy and is usually in the lower part of the body, but it can be anywhere. And often there can be swelling. And then cold pain is just bad. Cold pain is fixed and bad. And it's worse with the application of cold and better with the application of heat. So wind, cold, and damp can invade from the outside if there's a weak part
Mm-hmm.
and make it worse.
Okay.
So you don't want that. You don't want to let that happen. And so, so you want to protect the body against an invasion by an external pernicious
Okay. What
influence.
about the body and the limbs and the organ versus the brain when it comes to traumatic injury? And the brain is obviously a big one that we've been learning about the last 20 years with sports and the brain injury that they're finding out after people die. So when somebody has multiple concussions or car accidents or an athlete with head banging injuries, is that different than treating the tendon in the foot?
And I gotta think about that one. That's a
Because they're
tricky
both
one.
traumatic injuries. It's just the effects are different.
I am gonna say, don't quote me on this, but
Okay.
I am gonna say that they are the same and they are all similar but different.
Similar but different. Okay.
Similar but different. Because when the brain is involved, consciousness is involved, or
Okay.
what we would call the Shen or the spirit. So when the spirit is involved, that moves us in a different direction. Yes, do we treat the traumatic injury the same? We do, but there's going to be an added level of complexity that is going to involve the spirit, which
Okay.
will affect the internal organs in its own unique way.
But what about the concussion thing in general? Just treating it. And somebody comes in and says to you, I was in an accident or sports concussion. Like, what do you do?
So that would probably fall into the realm of a windy disorder,
Okay.
because it would be a lot of weird symptoms that come and go and affect the body in different ways. There could be dizziness or vertigo or blurry vision. And that's all related to what we call the orifices of the heart, which is the eyes and nose and mouth and ears. And so, again, we would have to take a look at that, not just as a traumatic injury like the foot patient, but also that the spirit has been affected, and how has that been affected, and how are these orifices been affected, and what is the underlying constitution, what is the underlying deficiency or excess that has to be addressed for those symptoms to have to resolve.
What about something that's semi-debilitating, like an injury so bad you can't walk, or a traumatic injury so bad you can't see, or you can't move your something? Is there levels of severity that change the treatment options or the course of treatment, or whether you want to treat or just send them off to Western medicine?
Well, like I had a patient recently who had just had a stroke, pretty major stroke, and she had had a major stroke a few months earlier.
Oh, wow.
And she had a blood clot in her brain. They
Oh.
had to go in and take it out. And she was in a very, very, very bad state. And her family brought her in. And, in China, I would be working in a rehab facility, and I would acupuncture this woman twice a day as part of her physical rehabilitation, right? But we can't practice like that here.
Right.
And so I told the family, I said, I'd love to work with her, but it's just not practical, that I don't have, I have something to offer her, but I kind of can't, because it would just be too difficult and too expensive and just too hard to get her into my office and get her out of my office. I mean, she would really benefit from acupuncture as part of her rehabilitation in a hospital. And yeah, so they actually put her in a rehab hospital, which is exactly where she belonged. So, it's not just the medicine, it's not just the medicine, but it's also culturally, like, what do we really have? What can we really offer? And so in that particular case, she was far better served by Western medicine than by what I could do for her.
What about traumatic injuries that are never corrected or repaired? And what I'm thinking of, an injury like my grandfather, when he was a child, broke his finger, never had it repaired. So his finger was always like that. And as he got older, he had a cascade of issues in this area of his hand and arthritis.
Yeah, I mean, and that's what happens. It's like if the results of wrong treatment are themselves
traumatic.
a secondary injury, right? So, if somebody comes to me and says, well, I broke my finger 20 years ago and I'd really like it to be fixed. Well, we'll see. I mean, we'll give it a try. I don't know. Maybe not. We'll have to see what happens. Because again, that's like so old that I don't know how much success that we can really have.
And it should have been surgically repaired, and then you working with it as well.
Right. So there's there's that, and then sometimes people have like arthritis, or they'll just or they have, like, I have a patient, I'm seeing her tomorrow actually, who's had numerous back surgeries. I can't even remember how many. And now she's having all kinds of pain. And sure enough, one of her fusions, right? So it's like, here's your spine, and they fuse this part.
Oh,
what happens is above and below, they have hypermobility, right? Too much movement because this isn't moving, right? So they end up having problems here and here.
Oh.
So then they want to fuse it again, right? So they're talking to her about doing a procedure, and I mean, I don't know if that's, well, I know it's not something she wants to do because she's had so many surgeries in the past and is now clinically disabled.
Okay, and then lastly, where's the line between when we have a traumatic injury coming to you versus going to a Western doctor? Obviously, if you break a bone, go to
you're in a car accident, go to the ER, for God's sakes.
But like your patient with the tendon in the foot, you should take a crack at it before she goes and has foot surgery or anything.
Absolutely, right? Because there really isn't a surgical repair for her. There just isn't. So, but what she needs to do is commit to behavioral change, and then she needs to commit to some treatment.
Right.
and not just come in, ooh, it hurts today, and then I'm not going to come in for another 3
Right,
months.
right,
You
right.
know, it's like, no, you actually have to come in until the tendon is healed.
It's almost like you made the commitment to get the injury, so now you need to make the commitment to heal the injury.
Right. That's very
I
true.
love it. Anything that we've left out with the trauma?
Well, let's see. Trauma. We talked about what is trauma.
Mhm.
We talked about the different types of trauma. We talked about how Western medicine treats it and how Chinese medicine treats it, and how that they're similar but also different. We talked about the length of time that injuries that you should hope for a resolution. We talked about primary and secondary injury. We talked about factors like age and constitution and maybe what you do for a living that might set people up for to be more likely to suffer an injury. Children and older people tend to be more injured than people in the middle. We talked a little bit about the tongue and the pulse. We talked about herbs and traumatic injury, and we
Sounds
talked
like
a
we got
little
it
bit
all.
about when you go to Western medicine and when you come to see me. Yeah, I
Okay,
think that might be everything.
sounds like we got it all. Okay, for traumatic injuries, fascinating stuff.
Yeah,
First of all,
I mean,
try to avoid them.
try and avoid them, and then also, what I tell people is, if you're still suffering the effects of a traumatic injury and it's been more than 2 months, then something's missing. And often I have found in my experience anyway, that piece that's missing is the energetic part.
Okay.
And that's like the car accident patient that I'm going to see tomorrow. I mean, she'd been in treatment, in good treatment. I mean, she was treated with a chiropractor who knows what they're doing, and physical therapy, and she has an orthopedic surgeon. And 9 months later, one acupuncture treatment, and she's like drastically better. I mean, she said her pain was like from an 8 to a 2 or something.
Wow.
Yeah, I mean, and that was after one treatment. I mean, because that was just the
The
missing
missing link
piece.
there, yeah.
So I see that a lot.
Wow, fascinating. All right, traumatic injuries. There's a whole deep dive into the topic with our regular expert on the subject, Susan Wellman, who is a Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. And as always, her information comes across the contact information comes across the screen every so often. Get in touch, make appointments, ask great questions. She's great at getting back to you and answering questions at the end of the day. She does all her emails and everything. So really interesting stuff. Thank you so much, Susan. You may also, in the bottom section, and then leave your comments in the comments section. We'll get whatever we need to get for you. And as always, the stars of the show are Leo, the black flat hair, just back from the groomer this morning, still with his bandana. Marty is the gray wire hair. It was all in the family earlier with Sonny and Joel, the kitty cats, coming through. So everybody's on set today. This is the In Medicine and On Medicine podcast. I'm Scott. Thanks for joining us. Have a great day. We'll see you next time.